So hi, everyone. I'm so grateful to be here. Thank you to Dr. Martinez and the Advanced Rhode Island CTR Planning Committee for inviting me to be here. I'm really excited to talk about how you can impact federal health policy. So I just spent a year working as a Senate staffer for Senator Patty Murray, who is the ranking vice chair of the Appropriations Committee in the Senate and the senior Democrat senator from Washington State. She's actually the most senior Democrat in the Senate in general. And this is the first time I ever felt tall. So just some disclosures, I'm a VA scientist. I receive money from the VA, from the NIH, and some from foundations, and nothing that I'm saying today has anything to do with those institutions, and I'm actually not on the clock at the VA for any VA officials who might be watching. So as you know, you've heard about our Bridge program, which launched almost 8 years ago, which is very exciting. And it's been such an incredible collaboration with so many people in this room, so many of our faculty and staff who work on it. We've been doing so much to move evidence into practice, both here in Rhode Island and also throughout the country. But I felt that one of the things that was really missing from my own personal skills was to try to understand about policy. I really felt that when we talk about sustainability, it came up in the panel this morning, that I felt like the policy lever was something that I personally didn't know very much about. And so I applied to and was selected for the Robert Wood Johnson Foundation Health Policy Fellows Program. And this is a residential program where they take people who work in health and healthcare and bring them to Washington, D.C. You go through a pretty extensive orientation through the National Academy of Medicine, and then you, sort of like a match process, find a place to work in either the Senate, in the House of Representatives, or you can also in the White House. And this was just an incredible experience. I went in thinking, I used to actually teach health policy. I worked at Boston University School of Public Health, and I taught a health policy and management class and thought I knew something. And I want to apologize to all of my students who had me as a professor, because I really thought I knew a lot about it and then spent a year learning that I didn't know as much as I thought. And during the time when I was in the Senate, I read this article that came out almost a year ago, March 22nd, 2025, from the New York Times. It's actually an article about learning how to play mahjong, which I still don't know how to play. But this article had so many interesting things about what it's like to learn something new. And there were a few quotes in here that I made a note of, knowing that it would someday be relevant to someone who I was talking to. And so here, they talk about why it's so hard to be bad at something. We spend so much of our life as either health professionals or researchers trying to be really good at something, and it's very uncomfortable to not be good at something, and it's not a place that we want to go. And that, the bottom quote is about, this person who's writing, Melissa Kirsch, says that when she read a story about how birds, chicks, when they're ready to hatch, develop an egg tooth, a sharp little structure on their beak that they use to peck its way out of an egg. How incredible. How do we grow our own egg teeth to generate our own tools, to crack our own shells, escape our too tight enclosures, and emerge into the light? And I really felt that this is what I was doing in the Senate, is developing not quite an egg tooth, but new tools that I could then use to think about how we take our research evidence and move it into practice. And it was just a really nice analogy for being in a situation that from the minute I walked in, I knew nothing about, and yet having to perform every day as if I was an expert in something. So before I go on to talk about some of the things that you can do to impact federal health policy, I just want to ask a question. What do you think is one thing a Senate staffer does every day? And I would love for you just to shout out whatever it is that you think.
Answer phones.
Answer phones?
Read the news.
Read the news? Travel, they definitely travel to work. What was that said over?
Local paper.
Read a local paper for the representative or senator that they're working for?
Go to meetings.
Yeah, any specific type of meeting?
Everything.
All meetings, lots of meetings.
Meetings, yeah. Argue a lot.
Argue. Any other things? Research? Well, one thing that a Senate staffer definitely does every day is meet with constituent groups. All day, every day, all the time, even if they have a packed schedule. In my office for Senator Patty Murray, this is maybe 2.5 days worth of meetings with these groups. This is a lot of meetings. Our meetings are not long, 25 minutes at most, but every day people would come in to tell us, the Senate staffer on the health legislative team, why their issue was the most important issue that we needed to focus on at that time on that day. And you can see there's a lot of different issues on this board. There's Alzheimer's disease, there's type 1 diabetes, there's flu, there's gene and cell therapy, there's colorectal cancer, there's a lot going on. And each of these groups, it was the most important thing, and a Senate staffer is doing a lot of different things. And so what I want to tell you is that the most important thing that you can do to impact federal health policy is turn your issue into a story. Stories are so important. We are trained as researchers to think about evidence, and we do our research, and we want to share that. But you will have so much more impact if you make it part of a story. Either someone that you serve who is a client of yours, a reason why you chose to go into that space to do that type of research, something that is quite honestly vulnerable and emotional will get the attention because they hear all day long about why a particular issue is so important. Your story is going to make that issue stand out so much more. And I would be in these meetings and I would think, some people are really great at telling their stories, and some people are so bad at it. And I wanted to become really good at it. So I knew that when I came back, I would need to take a class to learn about that, which I'll tell you about in a second. But the other thing is to remember that the person's office that you are meeting with, they also have a story. They have a story for why they ran for that Senate role or that House of Representatives role or why they are in this executive agency. And their websites give you so much information. I actually wrote this about Senator Murray, and you can go to her website and see a lot more information. But she was called the mom in tennis shoes in a derogatory way in the state of Washington because she was a preschool teacher. And they were going to take away preschool funding in Washington. And so she picked up her 2 little kids from school after she was done teaching. She went to the State House in Olympia, and someone told her there that she was never going to be able to impact any change in the state because she was just a mom in tennis shoes. That has become her slogan for the last 33 years. She got all the signatures that she needed to put it on a referendum on the ballot. They ended up keeping the preschool funding. She ran for the school committee, the school board where she lived. Then she became, shockingly, in the 80s, the first state senator who was a female in Washington state. And then she became a senator in the US Congress, in the US Senate. And she still is called the mom in tennis shoes. She still wears tennis shoes. In fact, in the office, they said you have to wear a suit every day, but you can wear tennis shoes. She got the Senate floor to change their rules. You can have tennis shoes on the floor. And so knowing about her, knowing that she comes from this preschool education, knowing what matters to her, if you read further, you'll learn about reproductive health, you'll learn about veterans, you'll learn about how her family was able to go to college through the GI Bill, you'll learn that her family was on food stamps. All of these things really matter. And so when you know the story of the person that you're going to talk to, you can interweave that with your own story, and you can make a really powerful impact for what you're trying to change. And so I took a class at the Harvard Kennedy School to learn all about stories. And people tend to think that like stories are just anecdotes, but stories are the way to bring your lived experiences and your values to life. So stories enable us to communicate these values and our lived experiences rather than the abstract principles that perhaps we talk about in our research. And so I'm not saying that any of you need to go to a storytelling class, but really think about how you, when you talk to people, what is your story of yourself? Why is it that you're doing what you're doing? What is the story of us, those in the room, that we can all impact together? And what's our story from now? What's the action step that we need to take? And that's how you can really use the stories. When you are competing with all those other professional societies who are trying to get the attention of a health policy official, this is what is going to matter. So, in terms of bluff, the bottom line up front, which is a good federal government term, when I think about how you can impact federal health policy, I think about visits to Washington, which also can be virtual. I had Zoom meetings with people. You don't have to travel there, but you can. You might be going with your professional society for a day on the Hill, and as part of that, they might ask you to do a congressional briefing. I'm going to come back to that in a second. While you're there, make sure you arrange to meet with the federal contingency from your state. They will meet with you. You are a constituent, and so it's a matter of just setting that up. Come in with a clear purpose. I can't tell you how sort of frustrating it is when someone would come in to talk to us and say, like, Alzheimer's is bad, heart disease is bad, smoking is bad. We know that, but what do you want us to do about it? Thinking about it from that perspective is really important. Share your story, like, as I just said, and ask questions of the staff. You can learn a lot if you turn a visit to a federal health policy staffer, if you make it two-way. What are their priorities in their office? What are they working on? What do they need help with? And believe me, if you offer to provide help, you can start to make a relationship with them. Be available for them. So, for example, on one of the things that we saw, there was something that said Stop Flu Coalition. They were very focused on different flu vaccines that were being developed. You know, flu vaccine changes every year. And in 2025, if you remember, there was a lot of debate about whether or not the United States was going to go to the World Health Organization meeting and decide what type of flu variants were going to be in the flu vaccine that year. And in the end, they sent people, but only virtually. They didn't go to the meeting. But I was able to reach out to that person who we met with and ask her, what do you think we should be focusing on? And what's our messaging that we should be doing for the flu vaccine? And so because I got to meet with her in person, and she seemed like the type of person that I could reach out to, I did. And we developed a relationship. I have her cell phone number. And so I think that, like, that's what you want to be able to do when you meet with people. And you just want to keep doing this over and over again. And this is that trust building. They are going to start to reach out to you when they have an issue. They'll be like, oh, I don't know enough about what I should do about children with anxiety. I'm going to reach out to Dr. Freeman. And they are honestly going to be excited that there's an expert that they can contact. I will just say as a caveat for everything is we do have an Office of Government Relations at Brown who they are advocating, they're doing the same thing that I'm talking about here, but they're advocating on top for what the university wants. I think it's a really good idea to keep them abreast of what you're planning on doing if you're doing this. You have every right to go and talk to people as a constituent of your state. You don't need Brown's permission, but you're not advocating for Brown. You're advocating for what you believe in and what's important to you. But just make sure that that line between Brown University and you is a little bit established, and to keep the government relations people aware of what your efforts are. All right, so I'm going to take a few of those things that I talked about in my bluff slide and just talk about them for you here. So congressional briefings. They happen every day in the Senate and in the House. Experts just like you come to Congress and tell you about an issue. This from the AAMC, they came last June to talk about the impact of federal actions on the academic medicine and the US healthcare system. And I sat in this room with 5 or 6 experts from medical schools around the country, all professor level, giving what we would normally give at like a research conference. And I'm looking around the room, and the median age in this room is probably 25. And I'm thinking, there's a total disconnect between what they're talking about and what the people in this room need to do. And so I raised my hand after they'd done like 45 minutes of presentations, and I said, what is one thing that you would like to say to the NIH director if you had that opportunity? And there was total silence. They had just spent like 10 minutes each talking about important things. And they were like, one thing? And I said, yes, one thing. And then I finally got them to do that. And the reason I wanted them to do that is I knew that I was writing a memo for the senator for this hearing that was going to be happening the next day, a review of the president's fiscal year 2026 budget request for the National Institutes of Health. And in that memo, I had developed talking points and questions, and they need to be brief. A senator has 5 minutes to both ask questions and get answers. And so I was able to take those questions from these people from the AAMC, build those talking points, and then put it into the memo working with the comms team in her office. And so I want you, if you are ever in a congressional briefing, to think like that. Yes, it's great to talk for 10 minutes about your research, but think about the people in that room and what they need from you in order to move your message forward. It's pretty brief. It's not a lot of information. So when you have an opportunity to share talking points, which you can email people in your representative's office, and you can say, here are some really important talking points for this hearing that you have coming up. And they may use them. And so make sure they're bulleted things, make sure you put the most important things at the top, you present it in bullets, make them easy to understand and read. The comms team is probably gonna change them, but if you really wanna let people know that if they change the indirect rate to 15%, what is that gonna mean for you? What is it gonna mean for your lab? That's what you wanna get across to them in a talking point. Legislation. Did I spell that wrong? Oh, no, I didn't, okay. This is what legislation looks like. And so you have an opportunity, you will be able to see what's upcoming, what has been introduced in previous Congresses, what's gonna be introduced again. This is introduced in the last Congress, 118th. It is now about to be reintroduced in this Congress. And what's important to say, this is what Senator Murray has done. This is the Advancing Menopause Care in Midlife Women's Health Act. This was sent to the Committee on Health, Education, Labor, and Pensions, the HELP Committee. What you need to know in terms of like what this bill is going to be doing is by looking at the jurisdiction of that HELP Committee. Every committee has a jurisdiction. And so, for example, Dr. Freeman mentioned earlier that she was focused on payment reform. You would want to talk to somebody who is on the Senate Committee for Finance because their jurisdiction is Medicaid and Medicare. You wouldn't really go and talk to somebody who's on the HELP Committee because they aren't able to really do anything about it. So it's really important that you understand what legislation is going to have what committee focus and the jurisdiction that that committee has, because otherwise you may have like a mismatch between what you need to do and what that committee has jurisdiction over. But this bill was introduced in May of 2024 with great fanfare. Huge champion, Halle Berry. Don't know if any of you follow her on Instagram. She talks about menopause on a daily basis. Huge proponent of menopause research. And so, this is what happened in May of 2024. You can see here there are Democrats and Republicans all joining together. When I joined, I had the opportunity to bring more research evidence into this bill because it didn't go anywhere in that Congress and it was going to be reintroduced. And so I looked at what the key provisions of that bill were, and then I was able to use my research skills. And this is the other thing I'll say is that research skills come in handy. And I was able to go to a whole bunch of different stakeholders for this particular research and learn what they think needs to be done in the menopause research space. Some of you might be part of these organizations. And then I was able to create updates to the bill. And this is how these people, they're not in Senator Murray's office, but I was able to talk to them. They responded to my emails quickly, they answered my phone calls. Their research is now part of this bill, which is going to be reintroduced in a couple months. And so that's the other thing to remember is that you can take your research and talk to people in these offices knowing that a piece of legislation is something that they're working on, and your research can be part of this, which is really exciting. And I still stay in touch with these people to let them know what's continuing to happen with this bill. And then the final thing I'll talk about is oversight. Oversight is a tool that the minority uses in Congress. And it's to make sure that the federal agencies that we fund are doing what they're supposed to be doing. This came out April 22nd, 2025, NIH guts its first and largest study centered on women, the Women's Health Initiative. Outcry across the board. Do you remember when women was a bad word to say? They canceled the Women's Health Initiative. What you need to, so this is the very next day, April 23rd, 2025. Our phones, our emails are going crazy because where's the Women's Health Initiative Coordinating Center? The Fred Hutch Cancer Center in Seattle. This is very topical to this particular office. And so if something is happening to you, you can find the people who are the constituent representatives for that group, and even if they're not in your own state, and reach out to them. The Women's Health Initiative is across the country, but the coordinating center is in Seattle, and we heard from people across the country about this. So a day later, we had a press conference, we had press releases calling on the government to change. And then on May 6th, just a week and a bit later, the Women's Health Initiative put out this statement that the previous decision to not renew has been rescinded, and we can move forward with new task orders in September. Like, that is the power of having researchers talk to federal health policy staff within offices that can do something about it, because that is part of their constituency group. So I really just want to make sure that, like, you never shy away from being a squeaky wheel, that this is how you impact federal health policy. So in summary, please don't be afraid to learn new tricks, like that Mahjong article. It's really critical that we put aside what we don't know and think about what we can learn in these situations. Take the time to develop relationships, answer emails, have a conversation with people when they reach out to you. Even friendly offices need to know that you care about an issue. Share your research as a story. This is so important. You can do this in in-person or virtual meetings. Help them to develop talking points. And then also there's another thing called questions for the record. If they don't use your talking point, they can use it as a question for the record that requires the nominee or the person who's going to a hearing to answer. And finally, speed matters. With like that Women's Health Initiative piece, like we didn't need someone to talk to us 2 weeks later about the importance of women's health. We needed to talk to them like immediately. So trying your best to stay on top of what's happening in both the real world and what's happening in terms of policy changes, but also looking at the calendars of the different committees for which you're interested in their jurisdiction. That will help you be on the same timeline as the people who work in policy. And huge thanks to Senator Murray's office, to the Robert Wood Johnson Health Policy Fellows Program, to the National Academy of Medicine who provided support, to both the Bridge team and Brown University for letting me leave for a year to learn all about these things. And this is my dog hanging out in front of Senator Murray's office. The Senate and the House are actually incredibly dog-friendly places. So anyway, thank you.
Thank you so much. Thank you all so much for being here. I do want to make sure that we give another round of applause for the CTR folks who made this possible. Thank you, thank you, thank you, thank you. And we will be doing this every year. So next year will be different. We see this as kind of a bookend to the Community Engaged Research Retreat, which is also done here at Brown. So I think this is our wrap up here. And the only thing I think for you all to know is we're going to be sending you an evaluation survey. We really, really value you completing that and letting us know what you thought, what we could do better, what you'd like to see even next year. That would be really, really useful. And eventually we are going to look to see if new connections were made from this retreat.